Well, welcome back. It's still Wednesday, the 16th of March. Now, I want to do a bit of a brief global orientation here, but I want to look particularly at Australia, which is really quite interesting because Western Australia and New Zealand have just really opened up in the past few weeks. And what we're seeing there is really quite fascinating as we see Omicron go through a vaccinated population. And it's kind of a deja vu almost, really, because we're seeing the kind of case numbers that we had seen in Europe with previous waves. So they've kind of come to this. It's all kind of delayed by a period of time. But let's look at the graphs because it shows it much better than I can explain it. Now, here's new daily confirmed cases. Now, India, we know that there's essentially no testing, but we do know that the pandemic has died down. The United States, the testing is very limited. But we do know the numbers have died down. I mean, just look at this United States line here, the reduction, really quite marked. Canada numbers are down, but again, testing in Canada is appalling. Now, the United Kingdom numbers are officially up, and this is despite low levels of testing. We know when we look at other sources of data, such as the Office of National Statistics or the COVID symptom tracker app, the prevalence is really quite high in the UK. As we saw from the Office of National Statistics, we're looking about 1 in 20, 1 in 25 people currently infected, so pretty high. But definitely been an increase in the United Kingdom just recently. Australia, of course, these increases now are not so much in Eastern Australia, they're largely in Western Australia, which has just opened up. Germany is high, but of course New Zealand, very high, and this is exactly as we predicted. We knew this was going to happen as Omicron starts transmitting through New Zealand, albeit causing relatively small numbers of hospitalisations and severe illnesses because the population is largely vaccinated, whereas of course the first waves in Western countries were in a unvaccinated, antigen naive, virus naive population, which of course is why we had the appalling hospitalisations and high death rates. So interesting to see that this is happening now in New Zealand, but exactly as we'd anticipated, of course. Patients in hospital per million. Now, this is accurate, and there has been an uptick in the UK, no doubt about it. But we also know that the prevalence in the UK is very high. So a proportion of these, we don't know how many, but a substantial proportion of these will be incidental findings. People admitted to hospital with COVID rather than from COVID. Don't have a detailed breakdown on that, but we can assume it's reasonably high. And we saw this, of course, weeks and weeks ago at the very start. In South Africa, we saw this several months ago. That's exactly what we're seeing as you get a widespread Omicron wave going through a population. So looking at hospitalisations, remember, so there we are, United Kingdom highest at the moment. Now, the United States is, and these are accurate hospital figures from the United States, going way down, but look how high it's been. I mean, this is the United States here. It's been appallingly high levels in the States, but now going down really quite dramatically as the United States well and truly moves into endemicity. Number of patients in intensive care, likewise. Now, Omicron has never been associated with high intensive care numbers. So if we look at the UK, since Omicron started round about beginning of January, say, the numbers have gone down in intensive care progressively and remain low. So pretty good news. Australia, thankfully, the numbers are low. Canada, they're going down. United States, the numbers in intensive care, again, look, this was the number in intensive care in the United States, it's just absolutely plummeted down. So really good news. Germany is picking up a bit because, of course, Germany are right in the heart now of their Omicron wave. So we would expect, albeit a small proportion of people to go to intensive care. But although it didn't happen in England, does it? We would expect some to go to hospital. So Germany, why the intensive care figures? I suppose we could say they're fairly level, really. It's the hospitalisation figures. Actually, we don't have the German hospitalisation figures there. But we do believe it's slightly higher, but intensive care slightly higher in Germany. I don't expect that to climb because we're doing Omicron wave now, but I do expect the number of hospitalisations in Germany to carry on going up for another week or two. That is quite conceivable. Just for the avoidance of doubt, it looks like there's still a bit of Delta in India, but everywhere else basically is Omicron. This is what we are seeing. We're 99%, probably even higher than that now in New Zealand, Australia, all Omicron. This is all Omicron now, which of course is a much better pandemic to have than Delta because it's associated with intrinsically less pathogenicity. Not a lot, but some. And of course, we're now in a largely vaccinated and natural immune population. So we are in a much, much better place than we were. Now, this is interesting, the R value. So R value of 1 here, of course, means neither increasing nor decreasing. So we see that Canada, the United States and India, the numbers are all going down, whereas the United Kingdom has actually gone into a positive R, as Germany and Australia are, and New Zealand, of course, quite high. So cases are increasing in the United Kingdom. R value is above 1 at the moment. This is resulting in some increased hospitalisations, but that's the price we're paying for massively increasing the level of natural immunity in the UK population. So it looks like it may well be a price well worth paying as it takes us into proper endemicity. Cumulative deaths, the United States, well, we've seen that the excess deaths in the States are well over 1 million, The United Kingdom, next in terms of deaths, Germany, Canada. India, of course, is greatly inaccurate. They are massively underestimated in India. As we saw from the Washington State study on global excess deaths that we saw, Institute of Health Metrics and Evaluation a couple of days ago. So India massively underreporting. But that's where we're at. So different countries in different stages of the Omicron wave. The UK still in it. The United States recovered largely. Australia and New Zealand still in it. Western Australia particularly still in the Omicron wave. Now let's get a report from Dr. Nigel Farrier, who's in Western Australia. It's a few days out of date, but still pretty relevant. And it really is interesting to notice how the Omicron is interacting with the vaccinated population in Western Australia as they've now completely opened up. And of course, that means the cases there are going up dramatically. So Nigel, thank you as always.
Just a quick update for you, John, from Western Australia. We've had quite an increase in number of cases throughout the whole month of March. We are now up to 90 people in hospital, and 3 of those are in intensive care. Half of those people in hospital have not had a vaccine. They released this data yesterday. I think 5% have had 1, 25 to 30% have had 2, and the remaining people have had 3. I don't know about those that are in intensive care, what their vaccination status is. That has not been released. But as you can see from this graph, we started off at the beginning of the month here with 1,175 cases. That went up to the 2,000 cases, and then on the 8th it started to increase 3.5, 4.5, and today, which is the 11th of March, we've just tipped 5,000 cases in Western Australia alone. So despite this increasing number of cases, over 5,000 now, lives in Western Australia are pretty much trying to live with COVID now. We have to wear masks out and about, and if you haven't been vaccinated, you're pretty stuck, because coffee shops, restaurants, pubs, clubs, etc. are all supposed to take your proof of vaccination before they let you in. So no vaccination, no coffee shops, no restaurants, etc. So that's basically it. Just thought I'd give you a quick update due to the increasing number of cases and the fact that we've now got quite a few in hospital and the beginnings of some in intensive care. Thanks very much, John.
Thanks as always, Nigel, for that. Now, it's good to get these on-the-ground updates. Western Australia, I'm not sure what the population is. Is it about 3 or 4 million people in Western Australia? I'm not sure. But to have 90 in hospital, actually, okay, it's not good, but it's not that bad. And only 3 in intensive care is really quite encouraging. So we're seeing the low level of people in intensive care in Western Australia, as we did in the UK. As Omicron spreads through a vaccinated population, that's encouraging. Now, half the people not vaccinated in hospital, of course, that means half the people were, so we are seeing a lot of breakthrough infection there. But we do know that this Omicron wave would be way, way, way worse in Western Australia had it not been for the vaccination coverage they have. 11th of March, a few days out of date now, but 5,000 cases, so I think we can assume it's much higher now. But of course, the cases are a subset of infections. There's way more infections than cases, so we can know that the infection rate is much higher than this, which is good because it means that Western Australia is acquiring natural immunity. And people that are not vaccinated are not getting the full ability to move normally in society. Let's hope that natural infection is recognised as generating immunity which is equal to vaccination, and that things can go on to a more individualised basis. So really interesting example there, actually, Western Australia. If there'd been no vaccine coverage at all when Omicron arrived, it would probably cause about 3/4 as many hospitalisations per capita as we experienced in the UK during, say, the alpha wave, because it's still pathogenic, but just not as pathogenic as Delta. So without vaccination, there'd be a lot more people hospitalised, there'd be a lot more people in intensive care, there'd be a lot more people dying in Western Australia than there are now. And the vaccination has really helped that. But let's hope that they realise that this is the time when they can now have natural immunity on top of the protection that they are enjoying from the vaccination, which is the way to get longevity of herd community immunity and indeed individual immunity. So I'm actually, okay, short-term difficulties, but quite optimistic about Western Australia there. They've probably done the right thing. Opening up, certainly the right thing to do now, because they can't be isolated from the world forever. But doing so when they had good vaccine status. Most people vaccinated relatively recently in Western Australia. So as they gain the natural infection and as they gain the natural immunity that comes from that natural infection, they're going to be largely protected from hospitalisation and severe illness and death by the vaccine, which means it's the ideal time for the Omicron variant to sweep through Western Australia, giving rise to widespread and, we believe, long-lived natural immunity. So thank you, Nigel. And you didn't really say whether you're optimistic or pessimistic there, but I think you would probably agree with me that we can be fairly or very optimistic, in fact, about Australia. So hope that global update helps. We are in the end of this for most. It's just that Australia and New Zealand are tagging along a bit late. Germany, as we've seen, tagging on a bit late. And we believe that a lot of the cases in the UK are incidental, although it hasn't gone away yet. And Tim Spector actually said this. He told me this a few weeks ago. He said we're probably going to see roughly about 1 in 30 people with the virus prevalence up until the better weather starts coming on in April, May in the UK. And the prediction he's made there does seem to be coming true. So thank you for that, and thank you for watching.